For our next story, we leap forward to the late 15th century, when Europe was gripped by one of the deadliest sexually transmitted diseases in history, syphilis. The disease appeared in Naples around 1494–1495, possibly carried by mercenaries, and rapidly spread across Europe. Its symptoms were horrific. According to accounts from the time, sufferers developed ulcers, pustules, and lesions that destroyed the flesh down to the bone. Victims' faces rotted away, their noses collapsed, and they wandered the streets like Renaissance zombies. In this state, they were feared and ostracized. The Italian physician Girolamo Fracastoro described syphilis as a disease that consumed not only the body but also the soul. Without antibiotics or effective treatments, sufferers turned to mercury ointments and aromatic baths, which were often worse than the disease itself. As the epidemic raged, some surgeons attempted to restore the noses that syphilis had eaten away. One of the pioneers of this field was Gaspara Tagliacozzi, a 16th-century Italian surgeon. Medical historian Lindsay Fitzharris describes how Tagliacozzi developed a technique to reconstruct the nose by cutting a flap of skin from the patient's upper arm and attaching it to the damaged nasal cavity. The patient's arm would be bound to their face for about 2 weeks until the graft took hold. Contemporary descriptions reveal that surgeons first purged the patient, then used pincers to lift the skin of the upper arm, passing a knife underneath to create a flap. This piece of skin was gradually thickened and shaped. When ready, the surgeon cut one end of the flap and sewed it onto the face, leaving the other end attached to the arm so blood could continue to flow. After the graft joined to the nose, the flap was severed from the arm and further shaped, a process that could last months. The resulting nose sometimes turned purple in cold weather and could fall off, yet Tagliacozzi boasted that his constructions were better than the originals. The combination of syphilis and experimental surgery created scenes that are difficult to imagine. Picture a man or woman with half a face eaten by disease, their arms strapped to their head, unable to move for weeks while a new nose slowly fused into place. It is a testament to human ingenuity and desperation. Even in the face of rampant infection and social stigma, people sought to restore a sense of normalcy. Today, reconstructive surgery is a respected medical field, but its origins lie in a time when patients resembled the walking dead and surgeons worked by candlelight.